Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and we are discussing this topic today, which we have discussed multiple times. It's just about being in the hospital. You are speaking to a 45-year-old woman who has been admitted to the hospital with a suspected stroke. So this woman has suspected stroke, means she doesn't have a stroke, but she is suspected with it. You have been asked by the doctor again. This is a passive voice. हैव बीन प्लस थर्ड फॉर्म दैट मीन्स बीइंग अ नर्स आपको डॉक्टर के द्वारा बाय द डॉक्टर यू हैव बीन एडवाइज्ड टू एडमिनिस्टर वारफरिन इंजेक्शन एंटीकोएगुलेंट टू द पेशेंट टेक द मेडिकल हिस्ट्री ऑफ द पेशेंट बिफोर गिविंग इंजेक्शन। तो पहले आपको मेडिकल हिस्ट्री लेनी है कि आपको कोई और प्रॉब्लम तो नहीं है। तो दैट मीन्स दैट इज हाउ द टॉपिक विल गो, दैट बेसिकली फर्स्ट यू नीड टू टेक द medical history of the patient, and second thing after that is explain that after the injection warfarin needs to be taken in the tablet form। तो टेबलेट फॉर्म पूछनी है कि वारफेरिन अभी तो हम आपको इंजेक्शन दे रहे हैं, उसके बाद आपको टेबलेट फॉर्म में लेना है। एक्सप्लेन दैट यू नीड टू चेक विद द डॉक्टर इफ शी कैन कंटिन्यू विद हर हर्बल सप्लीमेंट, इट मे इंटरफेयर विद द वारफेरिन। तो शायद हो सकता है जब आप हिस्ट्री पूछोगे तो शी विल लेट यू नो अबाउट दैट इफ शी इज हैविंग सम प्रॉब्लम, तो उसके लिए वो शायद हर्बल सप्लीमेंट्स ले रहा होगा। तो आपको बताना है कि आपको हर्बल सप्लीमेंट्स अभी नहीं लेने, क्योंकि वो वारफेरिन के साथ इंटरफेयर कर सकते हैं। तो डॉक्टर से पहले पूछना पड़ेगा। एम्फेसाइज द इंपॉर्टेंस ऑफ कॉशनरी मेजर्स रिगार्डिंग वारफेरिन, लाइक विटामिन के को डाइट में कम करना है, मिनिमाइज विटामिन के, क्योंकि आपको पता है विटामिन के तो कोगुलेंट होता है, तो वारफेरिन के साथ इसको मिनिमाइज करना है। और ओवर द काउंटर मेडिकेशंस को नहीं लेना कि डॉक्टर से पूछे बिना, एंड टेक अ डोज एट द सेम टाइम। और वारफेरिन की जो डोज है वो हर दिन एक रेगुलर टाइम पे लेना है। ऑफर टू प्रोवाइड अ डिटेल्ड पेशेंट इंफॉर्मेशन लीफलेट, देन यू हैव टू गिव अ लीफलेट। एडवाइज द पेशेंट टू स्टॉप द मेडिकेशन एंड कॉन्टेक्ट द doctor immediately in case of any prolonged fatigue. So that means this is the topic that we are going to discuss. और अब जब आपको ये रोल प्ले पेपर में मिलेगा, यू विल हैव 3 minutes टू प्रिपेयर, एज आई ऑलवेज से। आपको ऐसे 2 रोल प्ले आएंगे पेपर में और आपके पास 3 minutes होंगे प्रिपेयर करने के लिए। सो यू विल हैव 3 minutes टू प्रिपेयर एंड 5 minutes टू स्पीक। बस ये ध्यान रखना है कि जब आप 3 minutes प्रिपेयर करोगे तो आपको ये सब बातें जो मैं कहता हूँ, जैसे कि हॉस्पिटल वार्ड में है, तो आपको पहले लिख लेना है गुड मॉर्निंग, आई एम अ नर्स हियर, आई एम नर्स हियर, माई नेम इज दिस। जो भी आपका नाम है आप पहले ये भी बोल सकते हो गुड मॉर्निंग माई नेम इज दिस। तो पहले हम ये लिख देते हैं जो हमारा फॉर्मेट है, गुड मॉर्निंग माई नेम इज दिस, आई एम अ नर्स हियर। सो अब यहाँ से अपने आप रोल प्ले को शुरू करो। सो यू हैव बीन एडमिटेड with suspected stroke and hence doctor has advised me to give you warfarin injection. So that is how you will go. First line को हमेशा लिखना है पेपर में। So take the medical history before, but before giving you injection बिल्कुल टॉपिक के हिसाब से, just make it very easy for yourself, but before giving you injection I need to ask you some questions. Some questions about your medical history. May I? तो इतना टाइम नहीं लगता है लिखने में। May I? क्या मैं आपसे क्वेश्चन पूछ सकती हूँ? तो कहेगी yes, okay. So could you please tell me about that any medical history do you have? वो कहेगी no, as such there is nothing, but yes, I am having polycystic syndrome for which I am taking herbal supplements. Otherwise, nurse, apart from this condition, I do not have any other problem. तो आपको पूछना है do you drink alcohol? तो वो कहेगी नहीं. So do you smoke? नहीं. So that is how you should ask your question. So be reluctant of idea of giving up your herbal supplements. Avoid taking medication. Explain your consent about whether it gives you that. Okay. So this is what you can gonna ask. So first of all you will ask, do you have any other problem? तो ये पूछना है। Do you smoke? Do you drink? That is how you will go about your questions. And does anybody take warfarin in your family? वैसे ये अपने आप नहीं, वो अपने आप बता देगी ये क्वेश्चन अगर उसे कोई प्रॉब्लम होगी तो. So I've written all the things whatever I can write. फिर उसके बाद जो नेक्स्ट टास्क है वो तो इजी है. वारफेरिन नीड्स टू बी टेकन इन द टेबलेट फॉर्म एवरी डे फॉर द नेक्स्ट 4 वीक्स. मतलब पूरे 4 हफ्ते आपको लगातार लेनी है एवरी डे. एक्सप्लेन दैट यू नीड टू चेक विद द डॉक्टर इफ शी कैन कंटिन्यू हर्बल सप्लीमेंट. अगर वो यहाँ पे हर्बल सप्लीमेंट बताती है तो ही आप ये पॉइंट बोल पाओगे. इफ शी डजंट टेल यू अबाउट और द एग्जामिनर डज नॉट टेल यू अबाउट द मेडिकल हिस्ट्री, अगर पेशेंट अपनी मेडिकल हिस्ट्री नहीं बताता है हर्बल सप्लीमेंट का तो आप अपने आप नहीं बोल पाओगे, तो आपको पूछना पड़ेगा. सो डू यू टेक एनी मेडिकेशंस. तो ये वाला क्वेश्चन भी आप लिख सकते हो अगर वो पेशेंट अपने आप नहीं बताता है तो. डू यू टेक एनी मेडिकेशंस और हर्बल सप्लीमेंट्स. अगर वो बिल्कुल नहीं बोलता है तो और एनी सप्लीमेंट्स. तो आपको ये क्वेश्चन ऐसे पूछना है. कई बार एग्जामिनर रिलक्टेंट होता है, लेकिन अगर उसने हर्बल सप्लीमेंट्स के बारे में बताया नहीं, इफ द एग्जामिनर हैज नॉट टोल्ड यू अबाउट हर्बल सप्लीमेंट्स और आप अपने आप बोल देते हो प्लीज डू नॉट टेक हर्बल सप्लीमेंट्स, सो दैट इज रॉन्ग. सो यू नीड टू टेक केयर ऑफ दीज स्मॉल थिंग्स. तो उसको बताना है बिकॉज इट कैन इंटरफेयर विद दिस. फिर आप आराम से बाकी चीजें बता सकते हो. सो नाउ द टास्क इज गोइंग टू बी वेरी इजी. नाउ आई विल मेक इट इजी फॉर यू और मैं आपको एक बार बोल के दिखा देता हूँ आपको पेपर में कैसे बोलना है. गुड मॉर्निंग, माय नेम इज भूपेश, आई एम अ नर्स ओवर हियर. So you have been admitted here with suspected stroke. Am I right? Yes, nurse. I'm really upset. Don't worry, we are here to help you. As you have been suspected with stroke, that is why I have been asked by my doctor to administer a warfarin injection to you, which is a kind of an anticoagulant. So before giving you this injection, I need to ask you some questions about your medical history. May I? Well, yes, nurse, you may ask me, but please help me. Of course, we are here to help you. There is nothing to worry. We assure you for the best services. So first question is that, do you have any other problem, any other condition that you have suffered from in the past? Well, yes, nurse, I am having polycystic syndrome. Okay. So are you taking any kind of medications or any supplements for that thing? Yes, nurse, I am taking some herbal supplements. And apart from that, I do not have any medical history. And the only thing I take is herbal supplements. I do not take any medications. Okay, well, that's great. Do you smoke? No, nurse. Okay. Do you drink? No, nurse. Okay. So now I have asked you about the questions of your medical history. So now I need to give you the injection. So may I? Yes, nurse. Okay. So after the injection, now you will feel better as this injection is an anticoagulant. So it will immediately start working in your condition, and also it helps in dissolving any kind of clot. Anticoagulant means it dissolves any kind of clot and it does not let clot formation. So now you need to take the same warfarin in the tablet form every day for the next 4 weeks. But nurse, I can't take it. Could you please tell me why can't you take the warfarin tablets? Well, nurse, my father, he also takes warfarin tablets and he regularly suffers from nosebleeds. Well, see, everybody is different. Like in your father's case, obviously that's great. That's good that you have told me about your father. So I will definitely convey it to the doctor. But in your case, at this moment, looking at your condition, as you are suspected with stroke, which majorly happens due to clot formation, so this warfarin tablet is must to prevent any kind of clot formation. But still, I will convey this information to doctor and doctor will take the final decision. So is it all right? Well, thank you very much, nurse. Okay. Also, I would like to tell you that I need to check with the doctor if you can continue your herbal supplements, as it may interfere with warfarin or can cause some side effects. So that is the another thing I will check with the doctor. So I will respond you for both the things. First thing that I will respond you is for whether you should take the warfarin tablets because your father has kind of nosebleed. So doctor will give you some supplements or medications if required. And at the same time, you need to take care that you should stop your herbal supplements if doctor says so. Otherwise, if doctor says that you can continue, then you can continue. Is it all right? Well, yes, nurse. Have you understood everything? Yes, nurse. Okay, that's great. So now I will like to tell you that there are a lot of cautionary measures that you need to take care of, especially while taking warfarin. So while you will be on warfarin, you need to minimize vitamin K in the diet and also you need to avoid over the counter medications due to their interaction with the warfarin. So please do not take over the counter medications as it can be dangerous. So please, whenever you have any kind of condition or you face any problem, always ask the doctor before taking any medication. Is it okay? Well, all right, nurse, I will inform the doctor if I have any problem. Well, that's good that you have understood everything. And also, as I have told you that you need to take the tablet every day once doctor confirms you. So you have to take the tablet at same time each day. Suppose you take the medications at 10 a.m., then next day also take the medication at 10 a.m. Next day, if you take the medication at 6 p.m., then you take the medication at 6 p.m. only. So do not change the timings of the medication. That means you need to take the dose at the same time each day. Is it all clear? Have you understood everything? Yes, nurse, I have understood everything. Okay, then I'm also giving you a leaflet which contains detailed information about warfarin and its side effects, and also to take care that you should not skip the medication and take the medication as per the prescription of doctor. So you have this leaflet, it contains the information about this medication. So even after reading this leaflet, or if you have any query later on when you reach home, please feel free to ask anything. All right. Okay, nurse. Well, that's fine. Okay, then fine. And last, uh, it is very important to stop the medication and contact the doctor immediately in case of any unusual or prolonged bleeding, as warfarin causes a kind of anticoagulant effect. So it causes the prevention of clots. So it prevents the clot formation basically. So please take care that it can lead to bleeding. So if you have any kind of bleeding and it does not stop, or kind of it is prolonged, so please contact us immediately and take this medication very seriously and as per the prescription. Is it all right? Well, yes, nurse, that sounds all good, but I'm a little worried. This seems to be a dangerous medication. Well, no, this is not a dangerous medication if taken in prescribed dose and prescribed amount as prescribed by the doctor. So you will be all fine. So you don't have to worry about anything. But at this point of time, when you are suspected with stroke, this medication is a life savior. So please understand, this medication will save your life. So it is important for you. Is it all right? Okay. So I reassure you there is nothing to worry about this medication, and take this medication as per the timings. That is how you speak your role play with complete confidence and authority. ध्यान से बोलना है. छोटी मोटी गलतियां होती रहती हैं, जैसे मुझसे भी होती हैं. दैट्स ऑल राइट. छोटी मोटे इफ्स एंड बट्स लग जाते हैं. दैट इज नॉट अ प्रॉब्लम. बट कीप योर कॉन्फिडेंस हाई, कीप योर फ्लुएंसी हाई, keep your tone better. And also, whether this is given or not, leaflet a leaflet should be given. It is a very nice thing. And apart from the leaflet, second most important thing apart from the leaflet itself is to reassure. Always in the end, I reassure you that there is nothing to worry. If you take the medications as prescribed by the doctor, you will be all good. So that is how you do your role play with complete control, complete practice. और आपको बहुत सारी प्रैक्टिस करनी चाहिए. और ऐसा नहीं होता कि डॉक्टर्स का रोल प्ले कोई अलग होता है, मेडिसिन के लिए अलग होता है. सेम रोल प्ले डॉक्टर को भी आ सकता है. बस यहाँ पे ये आएगा, गुड मॉर्निंग, आई एम डॉक्टर ब्राउन एंड आई एम हियर टू हेल्प यू as you have been suspected with stroke, so I'm giving you this warfarin injection. It's very important. But before giving you this injection, I need to ask you a couple of questions. May I? Yes, of course. Okay. So first of all, I would like to ask you that if there is any medical condition that for which you are taking any kind of medication. Yes, doctor, I am having this and this. Okay, don't worry. So now I am giving you this injection, and I will also prescribe you some tablets which you should take for the next 4 weeks every day. Would that be fine with you? Well, yes, doctor, but I'm really worried. My father has kind of nosebleeds with this thing, and also herbal supplements I take. Is it okay? Well, don't worry. You are taking these herbal supplements, and these herbal supplements are very safe, and there is nothing to worry. You can continue your herbal supplement for your disease, as well as can take warfarin. But yes, you need to take care of any side effects if you see. So if you notice any kind of side effects, you need to contact me immediately in case of especially unusual or prolonged bleeding or any other kind of side effect. Is it all right? Okay. Now I would like to emphasize the importance of cautionary measures regarding this medication. So with the warfarin, you need to be aware that you need to minimize vitamin K in your diet, and you should avoid over-the-counter medications without prescription by a doctor or by me. So you need to take care that you need to consult me for any of the medications you take. Suppose if you have any problem like even simple cold and you want to take any medication, so you need to contact me before taking any medications over the counter, because you would be taking warfarin. So some medications have kind of interaction. So you need to avoid that. Is it all good? Okay. The last most important instruction that I have already given you, that is you take the medication every day, but you need to take it at the same time. 10 a.m. means 10 a.m. I'm giving you that you should take the medications at 10 a.m. slot. So I always take the medication at 10 a.m. without failure. And last, I'm giving you this leaflet. It contains all the information about the warfarin, and you need to read this leaflet. If there is any doubt, you can contact our team or contact me directly anytime. Is it all good? Okay, that's fine. So I reassure you, there is nothing to worry, as you have been suspected with stroke. So we are just going to go for ECG and other stuff to make sure that what is going on and whether your heart is perfectly fine. And then you need to take care of yourself. So now you please follow the instructions. Here is your leaflet. If you have any problem, any kind of unusual or prolonged bleeding, if you notice, please contact on this number immediately. Me or my team would be available to help you. Is it all right? Okay. So there is nothing different. It's just about being there and executing your role play in the perfect way and with complete fluency. And for fluency, as I have always told you, you need to practice it. Keep talking in English. I have to speak in Hindi sometimes to make you understand. But if you will keep talking in English, it will make your job 10 times easier. So keep talking in English whenever you realize. You can't talk in English 24/7, but जैसे ही आपको याद आता है, as soon as you realize, अरे यार मुझे तो English बोलनी है, so please start talking in English. That will immediately help you and will lessen your burden. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you.